Most of us women have it and most of us hate it. I am talking about cellulite. And so to talk all things cellulite, the truth about it, is dermatologist Dr. Michelle Henry. Thank you for joining us.
Thank you for having me.
So a lot of people think, I included, that cellulite is caused by weight gain or poor diet, lack of exercise, but you say that is not true. So can you break the record down straight for us, but also give us some other myths that we can bust?
Yes. So there's a lot of guilt around cellulite, and those things that you mentioned are absolutely false. The truth is, I see cellulite in women from all walks of life. So women that live predominantly sedentary lifestyles to women who are marathon runners. And so the interesting thing about cellulite is that cellulite can get worse or be exacerbated by both weight gain and weight loss. So what is cellulite? We all know it when we see it, but it is a localized alteration in the contour of the skin. And it happens when three completely normal things happen. So one, the fat cells enlarge, the skin thins, and then there are these vertical fibrous bands that anchor the skin to the depth. They become thicker. And when they become thicker, there's this tethering that happens. And it's sort of like a mattress. We see this dimpling. And this is independent of lifestyle. It's more genetic and hormonal. And that's why we see it in 90% of women independent of their lifestyle. So although there's a lot of guilt and shame, the truth is there shouldn't be, because there's not a lot that we can do in terms of lifestyle to treat it.
That is so true, because I will say I did a fitness competition where I got down to 13% body fat. I think my normal was like 23, 25, and I still had cellulite. And I was the thinnest I'd ever been, lean with muscle, and I still had it. So that is so true. I mean, it's just genetic. So, for the majority of us. But can you touch on the emotional aspect? Because I realized there was really nothing I could do about it. But some people, they think, okay, well, nothing's working. So what do I do? How can we boost their confidence?
So, information like this can boost their confidence. It's hard. I tell my patients that cellulite is not just skin deep. A lot of women are affected psychologically by cellulite. A lot of women have a lot of guilt and a lot of shame about cellulite. The survey showed that, over 50% of women are really greatly bothered by their cellulite. 64% of them feel guilt or shame. 44% of them feel like it makes them look unhealthy. 42% are frustrated. And then a whopping 77% spend time and effort throughout their day looking to hide and conceal it. So this really can affect a woman's self-esteem and therefore her quality of life.
That is so true. You see all the magazines and everything's airbrushed and you think, why don't I look like that? I work out, I eat right, but like you said, that's just not always what it's going to be to make that go away, since it is genetic for the most part. So if people are, not everyone's bothered by it, right? People are cool in their skin, but some people are bothered by it. And if they are, you're saying there's a new non-surgical treatment that actually takes 10 minutes. Can you tell me about that?
Exactly. And just as you said, not everyone's bothered by it. And my goal is to empower women to either love the skin they're in or change things that bother them. And I love that there is a brand new, super safe, non-surgical, minimally invasive treatment for cellulite. And it's called QWO, QWO. So QWO is the first FDA-approved injectable in-office treatment for cellulite. Again, it takes 10 minutes. And it's approved to treat cellulite, moderate to severe cellulite on the bottom, which is one of the most common areas that women have cellulite and one of the most troubling areas. I use it in my office. The biggest side effect is a little bit of bruising. Of course, with any treatment, there's a potential for allergy. So I recommend that everyone see a physician to get a proper customized treatment and to really assess if they have any significant risk. And the way it works is it's made of this really cool enzyme called collagenase. And what collagenase is thought to do is it releases those vertical bands. And so when it releases those bands, it allows that fat to redistribute and it stimulates more regular collagen. So really reducing or effacing that cellulite. Again, very safe. This was tested on 845 women of all backgrounds, all ethnicities. So it is safe, it's easy, and it provides an easy option for a woman who wants to do something about her cellulite.
Okay, so QWO, writing that down, because I am one, and I love the skin I'm in, but that is something I do not like, is the cellulite. It just doesn't go away. So that's really interesting because, yeah, the creams and all that doesn't work. So where can people find more information, Dr. Henry?
So again, if you want to learn more, you can go to QWO.com, and there you can learn all about the treatment. You can find physicians throughout the country that are using this treatment and find someone that you can go have a full consultation and again, get that personalized, customized approach for your cellulite, easy 10-minute treatment. In my office, we do 3 easy treatments over 2 months. It's easy, it's fast, it's empowering because it increases a woman's confidence, and you can learn all about it at QWO.com.
Okay, I am going to be looking that up for sure. Thank you so much for your time. I'm sure a lot of women are really going to be interested in this procedure, QWO, for those who don't remember how to spell it. Thank you so much, Dr. Henry.
Thank you for having me.
Yes, and to see this segment again or to get more information,